Question 1. A patient with type 2 diabetes and associated chronic kidney disease, CKD, stage 3, is seen for a routine follow-up. According to ICD-10-CM guidelines for coding diabetes with manifestations, how should this be coded? A. Code the CKD first, followed by the diabetes code. B. Code the diabetes and CKD with two separate, unrelated codes. C. Use a combination code that links diabetes with the kidney disease. D. Code only the type 2 diabetes, as it is the primary condition. Answer: C. Use a combination code that links diabetes with the kidney disease. This question tests the concept of combination codes in ICD-10-CM, specifically for diabetes. The key clue is the stated relationship between type 2 diabetes and associated chronic kidney disease, which directs the coder to find a single code representing both conditions. ICD-10-CM presumes a cause and effect relationship between diabetes and many other conditions, like CKD, and provides specific combination codes to capture this link. For example, CODI 11.22, type 2 diabetes mellitus with diabetic chronic kidney disease, accurately reports both diagnoses in one code, reflecting the clinical reality. Always remember to look for a combination code first when the provider documents a link between diabetes and another condition. Question 2. The term adjudication in the medical billing process refers to what? A. The process of submitting a claim to an insurance payer. B. The final determination of a patient's financial responsibility. C. The payer's process of reviewing a claim and deciding whether to pay, deny, or adjust it. D. The act of appealing a denied insurance claim. Answer: C. The payer's process of reviewing a claim and deciding whether to pay, deny, or adjust it. This question assesses knowledge of key billing terminology, with adjudication being a fundamental concept in the claim lifecycle. Adjudication is the formal review process a health insurance payer undertakes after receiving a claim. During this step, the payer's computer systems and claim examiners check the claim for accuracy, medical necessity, and adherence to the patient's policy benefits before making a payment determination. For instance, a claim for a service not covered by the patient's plan would be denied during adjudication. Just think of adjudication as the insurance company's judgment day for your claim. Question 3. A patient undergoes a chest X-ray at an outpatient imaging center. The radiologist, who is an independent physician, later reads the X-ray and provides a written report. Which modifier should the radiologist append to the CPT code for the chest X-ray? A. TC, technical component. B. -59, distinct procedural service. C. -26, professional component. D. -51, multiple procedures. Answer: C. -26, professional component. This scenario tests the concept of splitting a service into its professional and technical components, which is common in radiology. The keyword clue is that the radiologist reads the X-ray and provides a written report, which is the interpretive, or thinking, part of the service. Modifier 26 is used to report only the physician's work, such as interpreting the results of a diagnostic test, separate from the cost of the equipment and staff used to perform it. The imaging center that owns the equipment would bill for the same service with a TC modifier for the technical component. A simple way to remember is that -26 is for the doctor's brainpower and report, while TC is for the technology and technicians. Question 4. In ICD-10-CM, what does an excludes one note under a code category indicate? A. The two conditions are unrelated and may be coded together if they exist. B. The excluded code is a component of the primary code and should not be coded separately. C. The two conditions cannot be coded together under any circumstances. D. The excluded condition should be coded first, followed by the primary code. Answer, C. The two conditions cannot be coded together under any circumstances. This question focuses on understanding a critical ICD-10-CM coding convention that excludes one note. An excludes one note is a strict instruction meaning that the code and the condition listed in the note are mutually exclusive and should never be reported together for the same encounter. The key idea is that the two conditions cannot occur at the same time, such as a congenital versus an acquired form of the same condition. For example, code category G40, epilepsy, has an excludes one note for seizures, R56.9, meaning a patient cannot be diagnosed with both epilepsy and a simple seizure disorder simultaneously. Think of excludes one as a stop sign. You can only pick one of the two codes, not both. Question 5. A patient is seen for a right knee arthroscopy with meniscectomy. During the same operative session, the surgeon also performs a diagnostic arthroscopy on the left knee to assess a different problem. Which modifier should be appended to the code for the diagnostic arthroscopy on the left knee? A. -51, multiple procedures. B. LT, left side. C. -25, significant, separately identifiable E/M service. D. -59, distinct procedural service. Answer, D. -59, distinct procedural service. This question tests the application of modifier 59 to differentiate procedures that might otherwise be bundled. The keywords are same operative session, but on a different problem at a different anatomical site, the left knee versus the right knee. Modifier 59 is used to indicate that a procedure was distinct or independent from other services performed on the same day, such as being performed on a different organ, at a separate incision, or for a different injury. Here, the diagnostic scope of the left knee is a separate procedure from the surgical scope of the right knee, and modifier 59 prevents the payer from incorrectly bundling them. Remember, use modifier 59 to say, hey, this wasn't part of the other procedure, it was truly separate work at a different location. Question 6. What is the primary purpose of the Health Insurance Portability and Accountability Act, HIPAA? A. To ensure all citizens have health insurance coverage. B. To standardize medical coding sets like ICD-10-CM and CPT. C. To protect the privacy and security of patients' health information. D. To regulate the cost of medical procedures and prescription drugs. Answer, C. To protect the privacy and security of patients' health information. This question assesses fundamental knowledge of healthcare compliance, specifically HIPAA. While HIPAA includes provisions for administrative simplification, like standardizing code sets, its primary and most well-known purpose is to safeguard protected health information, PHI. The HIPAA privacy rule and security rule set national standards for who can access patient information and how it must be protected from unauthorized disclosure, whether electronic, written, or oral. For example, a coder working from home must ensure their computer and internet connection are secure to comply with HIPAA. The easiest way to remember HIPAA's main goal is to think patient privacy and data security. Question 7. A patient presents for a scheduled follow-up for their hypertension. During the visit, the patient also complains of a new, painful wrist sprain, for which the physician performs a problem-focused history exam and prescribes treatment. Which modifier should be appended to the evaluation and management E/M code? A. -57, decision for surgery. B. -24, unrelated E/M service during a postoperative period. C. -25, significant, separately identifiable E/M service by the same physician on the same day of the procedure or other service. D. -59, distinct procedural service. Answer, C. -25, significant, separately identifiable E/M service by the same physician on the same day of the procedure or other service. This question tests the proper use of modifier 25, which is crucial for correct E/M coding. The key information is that a scheduled follow-up for one problem, hypertension, occurred at the same time as an evaluation for a new, painful wrist sprain, indicating a separate and significant level of work. Modifier 25 is appended to an E/M code when the physician provides a significant, separately identifiable evaluation service on the same day as another service or a minor procedure. In this case, managing chronic hypertension is distinct from evaluating and managing an acute wrist sprain, justifying a separate E/M service. A good tip is to ask if the E/M service was for a completely different reason or went well beyond the usual pre-service work for the other service provided. Question 8. In medical terminology, what does the suffix ectomy mean? A. Surgical creation of an opening. B. Surgical repair. C. Inflammation. D. Surgical removal or excision. Answer: D. Surgical removal or excision. This question tests basic medical terminology, specifically a common surgical suffix. The suffix ectomy is derived from Greek and universally means the surgical removal of a body part. Understanding this suffix allows a coder to quickly grasp the nature of a procedure from its name alone. For example, an appendectomy is the surgical removal of the appendix, a tonsillectomy is the removal of the tonsils, and a nephrectomy is the removal of a kidney. A simple way to remember is to associate ectomy with exit, as in making a body part exit the body. Question 9. Which of the following is an example of a code from HCPCS Level 2? A. 99213, office or other outpatient visit. B. E0601, continuous positive airway pressure, CPAP, device. C. 85025, complete blood count, automated. D. 00100, anesthesia for procedures on salivary glands. Answer: B. E0601, continuous positive airway pressure, CPAP, device. This question tests the ability to distinguish between CPT Level 1 and HCPCS Level 2 codes. HCPCS Level 2 codes are used to report products, supplies, and services not included in CPT, such as ambulance services and durable medical equipment, DME. The key is to recognize the format. HCPCS Level 2 codes begin with a letter followed by 4 numbers. Codes like 99213, an E/M code, and 85025, a lab code, are CPT codes, which are 5 digits long. E0601 is a classic example of a HCPCS Level 2 code for a piece of durable medical equipment, the CPAP machine. Remember, if the code starts with a letter, it's a HCPCS Level 2 code. Question 10. A patient is seen for an initial encounter for a severe laceration of the right forearm sustained when they were cut by a piece of glass at their home kitchen. Which seventh character should be used for the injury code? A. Initial encounter. B. D. Subsequent encounter. C. S. Sequela. D. G. Subsequent encounter for fracture with delayed healing. Answer: A. Initial encounter. This question assesses the correct application of the seventh character in ICD-10-CM for injury, poisoning, and other external causes. The key phrase initial encounter directly points to the correct seventh character. The A extender is used for the entire period a patient is receiving active treatment for the condition, which includes the initial emergency visit, surgical treatment, and initial evaluation by a new specialist. In this case, since this is the first time the patient is being seen for this new laceration, A is the correct choice. Think of A for active treatment, not just the very first visit. Question 11. Which part of the CPT manual would you use to find a code for an unlisted procedure, when a more specific category code is not available? A. The index, by looking up unlisted. B. The specific body system or service section guidelines. C. Appendix A, which lists all modifiers. D. The introduction section of the CPT manual. Answer: B. The specific body system or service section guidelines. This question tests the procedural knowledge of how to locate unlisted service codes within the CPT manual. While the index is helpful, the definitive location for an unlisted procedure code is at the end of the relevant subsection for that body system or service type. The clue is understanding the structure of the CPT manual, where procedures are grouped by anatomical or service categories. For example, if no specific code exists for a new type of heart procedure, the coder would look at the end of the cardiovascular system section to find the unlisted procedure, heart and pericardium code, e.g., 33999. A good rule of thumb is to go to the section where the procedure should be and look at the very end for the unlisted code. Question 12. In the context of evaluation and management, E/M, coding, what are the three key components of medical decision-making, MDM? A. History, examination, and medical decision-making. B. Number and complexity of problems addressed, amount and/or complexity of data, and risk of complications. C. Time, counseling, and coordination of care. D. New patient, established patient, and consultation. Answer: B. Number and complexity of problems addressed, amount and/or complexity of data, and risk of complications. This question targets the core elements of medical decision-making, MDM, a critical factor in selecting the correct E/M code level. According to the 2021 E/M guidelines for office visits, MDM is based on three pillars that measure the cognitive work of the provider. These are the number and complexity of the problems the provider is managing, the amount of data they need to review, like lab results or old records, and the overall risk to the patient from their condition or the treatment options. For example, managing multiple chronic illnesses involves higher MDM than treating a simple cold. To remember these, think of MDM as answering three questions: what's wrong? Problems. What do I need to know? Data. What could happen? Risk. Question 13. When a CPT code is designated as an add-on code, identified by a plus symbol, what is the main rule for its use? A. It can be reported as a standalone code. B. It must always be listed in addition to a primary procedure code. C. It is exempt from modifier use. D. It should be billed with a -51 modifier to indicate multiple procedures. Answer: B. It must always be listed in addition to a primary procedure code. This question tests the fundamental rule for using add-on codes in CPT. The key identifier is the plus symbol next to the code, which signifies that it cannot be billed by itself. An add-on code represents an additional service or procedure that is always performed in conjunction with a primary, or parent, procedure. For example, CPT code 11103, plus each additional lesion, is an add-on code that can only be billed after the primary biopsy code 11102 has already been listed for the first lesion. The golden rule is, an add-on code never stands alone, it always needs a primary code to piggyback onto. Question 14. A patient with Parkinson's disease falls and sustains a hip fracture. In this scenario, the hip fracture is the acute diagnosis being treated. What is the Parkinson's disease considered in this coding context? A. The principal diagnosis. B. A comorbidity. C. A sequela. D. An external cause. Answer: B. A comorbidity. This question tests the understanding of coding concepts like principal diagnosis versus comorbidities. A comorbidity is a pre-existing condition that will likely affect the patient's current medical care or treatment plan. In this case, The patient is being treated for the hip fracture, the principal diagnosis, but the Parkinson's disease is a significant comorbidity that could complicate their surgery, recovery, and risk of future falls. Reporting comorbidities gives a more complete picture of the patient's overall health status. Think of a comorbidity as a condition that coexists with the primary reason for the visit and can make treatment more complex. Question 15. A provider who suspects a Medicare patient may not have a service covered by Medicare is required to have the patient sign what form before the service is rendered? A. HIPAA Notice of Privacy Practices. B. Assignment of Benefits, AOB. C. Advance Beneficiary Notice of Non-Coverage, ABN. D. Patient Encounter Form. Answer, C. Advance Beneficiary Notice of Non-Coverage, ABN. This question assesses knowledge of Medicare-specific billing regulations, focusing on the ABN. The key phrase, may not have a service covered, triggers the need for an ABN. This is a formal written notice given to a Medicare beneficiary before providing services that are expected to be denied as not reasonable and necessary, allowing the patient to make an informed decision about whether to receive the service and accept financial responsibility. For example, if a patient wants a screening test more frequently than Medicare allows, an ABN must be signed if the provider wishes to bill the patient. Remember, an ABN is an advance notice to the beneficiary about non-coverage, protecting both the patient from surprise bills and the provider's ability to collect payment. Question 16. In ICD-10-CM, when a code first note is present, what does it instruct the coder to do? A. To report the underlying condition first, before the manifestation code. B. To report the code with the note as the primary diagnosis under all circumstances. C. To use an additional code only if space on the claim form permits. D. To ignore the note if the manifestation is more severe than the underlying condition. Answer, A. To report the underlying condition first, before the manifestation code. This question tests a mandatory ICD-10-CM sequencing rule, the Code First Convention. The Code First note is an instruction that requires the coder to sequence the underlying condition, the etiology or cause, before the code for the manifestation, the symptom or related condition. This rule ensures the code set accurately reflects the cause and effect relationship between two conditions. For example, for diabetic neuropathy, there is a code first note under the neuropathy code that instructs the coder to list the diabetes code, e.g., E11.40, first, followed by the neuropathy code. A simple way to remember is that the code first note points you to the disease that caused the problem, which must always be listed first. Question 17. Which term describes the anatomical position of the wrist in relation to the elbow? A. Proximal. B. Distal. C. Medial. D. Anterior. Answer, B. Distal. This question tests knowledge of basic anatomical directional terms. The terms proximal and distal are used to describe the position of structures on the limbs in relation to the trunk of the body or point of attachment. Distal means farther away from the point of attachment, while proximal means closer. Since the wrist is farther down the arm from the trunk than the elbow is, the wrist is considered distal to the elbow. To keep it straight, think of distal as being more distant from the center of the body. Question 18. What is the purpose of the placeholder X in ICD-10-CM coding? A. To indicate that a code is experimental. B. To allow for future expansion and to fill empty character spaces in codes that require a seventh character. C. To signify that a diagnosis is unconfirmed. D. To mark a code as a manifestation that requires an etiology code first. Answer, B. To allow for future expansion and to fill empty character spaces in codes that require a seventh character. This question focuses on a unique structural feature of ICD-10-CM, the placeholder X. Some ICD-10-CM codes are less than 6 characters long but require a 7th character to provide additional information, such as for the initial, subsequent, or sequela encounter for an injury. The placeholder X is used to fill in the empty character positions to ensure the 7th character is in the correct place. For example, the code for a toxic effect of an accidental overdose of aspirin is T39.011, which requires a 7th character. An X is added for the 6th character, T39.011X, before adding the 7th character A for an initial encounter, T39.011XA. Just remember, X marks the spot to hold a place for a future character or to make sure the 7th character is in the 7th position. Question 19. According to CPT guidelines, the time spent on an E/M service can be used for code selection only when what activity dominates the visit? A. Performing a physical examination. B. Documenting in the electronic health record. C. Counseling and/or coordination of care. D. Reviewing past medical records. Answer: C. Counseling and/or coordination of care. This question tests a key rule for time-based E/M coding. While total time is now a primary way to select an office E/M code level, the classic rule tested here still applies to many other E/M settings and was the historical standard. When more than 50% of the total face-to-face time with the patient is spent on counseling or coordinating care, the coder can select the E/M level based on time instead of the key components of history, exam, and MDM. For example, if a physician spends 20 minutes of a 30-minute visit discussing treatment options for a newly diagnosed cancer with the patient and their family, time can be used to select the code. A good tip is to look for documentation that says counseling and/or coordination of care dominated the visit. Question 20. A patient has a major surgery on June 1st with a 90-day global period. The patient returns to the same surgeon on July 15th for a follow-up visit related to the surgery. How should this follow-up visit be coded? A. Bill a new E/M code with modifier -24. B. The visit is included in the surgical package and is not billed separately. C. Bill a new E/M code with modifier -25. D. Bill the original surgical CPT code again. Answer: B. The visit is included in the surgical package and is not billed separately. This question assesses understanding of the global surgical package concept. The keywords are 90-day global period and follow-up visit related to the surgery. The global surgical package fee paid to a surgeon includes all necessary preoperative, intraoperative, and postoperative care, including routine follow-up visits related to recovery from the surgery. Since the July 15th visit is within the 90-day period and is for a related follow-up, its cost is already bundled into the payment for the original surgery and should not be billed separately. Remember, if a visit during the global period is for the normal, uncomplicated follow-up of the surgery, it's already paid for. Question 21. Which code set is used to report injectable drugs, chemotherapy, and other substances administered to a patient? A. ICD-10-CM codes. B. CPT codes. C. HCPCS Level 2 J codes. D. HCPCS Level 2 G codes. Answer: C. HCPCS Level 2 J codes. This question tests the specific knowledge of HCPCS Level 2 code categories. J codes are a specific subset of the HCPCS Level 2 system used to identify the type and dosage of drugs that are typically administered by a healthcare professional and cannot be self-administered. The key is to associate the letter J with injectable drugs. For instance, a provider's office would use a J code to bill for the specific antibiotic administered to a patient via N4 infusion during their visit. Think J4 juice or jabs to remember these are for drugs and biologics. Question 22. In medical terminology, the prefix Brady- means what? A. Fast. B. Painful. C. Slow. D. Large. Answer: C. Slow. This question evaluates knowledge of common medical prefixes, which are essential for understanding medical terms. The prefix Brady - comes from the Greek word for slow and is used to describe an abnormally slow rate. A coder will frequently encounter this in terms like bradycardia, which means an abnormally slow heart rate, or bradypnea, which means an abnormally slow breathing rate. The easy way to remember this is to contrast it with its opposite, tachy -, which means fast. If you know one, you can figure out the other. Question 23. What is the purpose of National Correct Coding Initiative, NCCI, edits? A. To identify diagnoses that do not support medical necessity for a procedure. B. To promote correct coding and prevent improper payments by identifying code pairs that should not be billed together. C. To provide guidelines for selecting the correct E/M code level. D. To convert ICD-9 CM codes to ICD-10 CM codes. Answer: B. To promote correct coding and prevent improper payments by identifying code pairs that should not be billed together. This question tests understanding of a major component of claims processing and compliance, the NCCI edits. The NCCI was developed by Medicare to prevent improper billing of procedures that are considered mutually exclusive or part of a more comprehensive service. These edits consist of procedure-to-procedure, PTP, pairs that identify codes that generally should not be submitted together for the same patient on the same day. For example, a code for a biopsy of a lesion is often bundled into the code for the excision of that same lesion, as the biopsy is considered an integral part of the excision. Think of NCCI edits as the insurance payer's automatic double-check system to stop incorrect code combinations. Question 24. A patient is seen for follow-up of a leg fracture that has healed. However, the patient now has a pronounced limp as a long-term result of the injury. What is the limp considered in ICD-10 CM coding? A. A late effect or sequela. B. A comorbidity. C. A chronic condition. D. An acute manifestation. Answer: A. A late effect or sequela. This question tests the concept of sequela, or late effect, coding in ICD-10 CM. The key clue is that the limp is a long-term result of a healed previous injury. A sequela is a residual condition that remains after the acute phase of an illness or injury has ended, requiring two codes, one for the residual condition itself, the limp, and a second code for the original injury with the seventh character S, for sequela, to indicate it is the cause. For example, you would code the limp first, followed by the code for the leg fracture with an S extender. Remember, sequela is about the sequel to an old injury or illness. Question 25. A patient has a diagnostic colonoscopy, during which the physician identifies and removes a polyp using a snare technique. How should this encounter be coded? A. Code only the diagnostic colonoscopy. B. Code only the colonoscopy with polyp removal, therapeutic. C. Code both the diagnostic and the therapeutic colonoscopy with a -59 modifier. D. Code the diagnostic colonoscopy and the snare removal as two separate procedures. Answer: B. Code only the colonoscopy with polyp removal, therapeutic. This question assesses a common procedural coding rule in gastroenterology. The key concept is the scope conversion rule. If a diagnostic procedure becomes a surgical or therapeutic procedure, you only code for the more comprehensive therapeutic procedure. Once the physician removes a polyp, the procedure's intent changes from diagnostic, just looking, to therapeutic, treating. The work of the initial diagnostic look is considered an integral part of the more complex surgical procedure. The rule is simple: always code to the highest level of service performed during the scope procedure.